And as I said, I'd mentioned the other patient who was twisted and whose symptoms in his leg would not have resolved without being able to test the body distortion and restore that properly by allowing the thorax to derotate on the pelvis rather than the other way around. So I think that again, it shows that analysis of movement strategy is important. Finding out what lies behind the failure to perform is the most important thing you can do. Identifying the failure to perform is not the end all of the interrogation. It is actually just the beginning.
Right.
You identify the failure to perform, it's just the beginning.
Yeah.
Finding the system which has failed the performance, or the systems, subsystems which have failed to give access to the performance, is the most important thing you can do, because then you can formulate a treatment for these systems. Yanking on his knee of this other gentleman is not the treatment.
Right.
Everyone has tried it. So failure to perform, failure to have full range of motion is the beginning of the problem. It is not the solution. It does not even tell you why he cannot do it.
But, well, it just lends itself to the idea. I mean, even I'm just thinking of a patient today. I mean, every day, but it's a patient today. They're standing in front of me, and I have them do a little bit of a single leg squat, and a single leg stance, and they're showing me a little bit of a collapsed knee on one side, a Trendelenburg kind of sign, and that in and of itself doesn't give me anything really. It doesn't tell me what to do. That test is so complicated, and there are so many variables and factors that can be throwing off the test that, it's nice to see that there's an asymmetry side to side and there's some type of problem, but just identifying that there's a problem doesn't do anything really.
No,
I mean, it doesn't
mean anything. Yeah. A Trendelenburg does not mean automatically
do
a weak glute. Yeah, exactly. It doesn't mean a weak glute-medius. Right. It could, but it doesn't automatically go. And it doesn't tell you why the gluteus medius is weak.
No.
So you're going to try and strengthen a gluteus medius that is struggling? It won't strengthen depending on what is wrong with it. And what if the weakness is coming from the foot? So it is a response to something else. So these are always why you must identify failure to perform, but then you must go back into what is the function. Is it an organic, a chemical, an energetic, lack of resources? Is it a processing problem? Or is it referred from some other system which you have not yet even started to investigate? And luckily for us, many times it can be quite straightforward. But for those for whom it is straightforward, they don't pose a problem. They get better quickly and rapidly.
Yeah.
But for those,
I was going to say also good. Go ahead, finish.
No, go on.
I was good. I mean, I was just going to say it's a good thing for us that you have a integrative assessment procedure and protocol to suss out all of these problems, to hone in and identify and screen what is actually a primary problem versus maybe some white noise. And, we're recording this at the end of December in 2023, and we're going to be starting again our integrative assessment course for 2024 in Chicago. And, you and I had met for lunch a couple of weeks ago, and
Mhm.
we were talking about the material and the
Mhm.
upcoming assessment course, and we've decided that, okay, over the past several years there's a part 1 and a part 2, and
Mhm.
now that we've done it a few times and we kind of have figured it out and clarified some things and changed some things, we've realized, yeah, there needs to be a part 3. So we're
Mhm.
going to be doing a part 1, a part 2, and a part 3 course for the first time this year. So I thought maybe we can talk a little bit about generally, what is the integrative assessment course? Why did we think it was necessary to create an integrative assessment
Mhm.
course, as well as more generally to, what we're going to try to accomplish in part 1, what we're going to try to accomplish in part 2, and why we thought a part 3 was kind of necessary. So I'll let you start a little bit.
Yes.
Why did we think an integrative assessment course was necessary?
Well, first of all, the integrated assessment course was born out of a long series of clinical encounters and frustrations over the years. I started back in 1999, I think it was, and spoke with a Dr.
You mean
Soltis
my
at the
senior
time.
year in high school? When I was in Cancun for spring break?
I guess so. Shows you what a loser I am. It's taken that long.
I've been at Coco Bongo for the past 10 years. You've been
I'm
working on
still I'm
patients.
still trying to get a better assessment going. Yeah. It's embarrassing, but at this stage in my life, I'm still trying to perfect an assessment, let alone the treatment.
Yeah, right. Let's not even get started on the treatment.
I know. I know.
If
I
we
will
can
have to.
just get this assessment down, we can finally start
Just,
treatment.
I know exactly. I will live. Yeah. I know. I'll have to come back in another lifetime to finish the course because it's going very slowly. But so the idea has been to find a red thread. And I remember once talking with Craig Liebenson, and we said, you know what? Wouldn't it be wonderful if you could assess somebody and go, this person is suffering from a crawling strategy deficit, or they are suffering from a turning deficit, and that this would then guide your choice of exercise and fundamental movement strategies into ADLs and finally into performance. And we were lamenting the fact that we were not there yet, but
Yeah.
that we hoped that it would be possible, that it would be logical, that would be the case. And that conversation has stayed in my head ever since. And that must have been 20 years ago. So it has been my goal and my dream that would be something achievable where you could assess somebody and go, this is a homologous movement problem, locomotory movement problem, or a turning rotary movement problem primarily, and the guidelines to recovery would follow these steps.
Right.
And so that is it. And with that in mind, the manual therapy skills became adjunctive to the restoration of movement, efficient movement. So, in going and learning techniques, it was necessary to go, well, where do these fit in, and are they useful? Are they helping or hindering the
Well, yeah, I mean, I
progress
think
of the rehabilitation process?
if you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.